know where you are, because I know that everybody who is on today doesn't necessarily join us for this meeting, but I know this topic is of interest to pretty much just about everybody. And so we've got a big audience here today. Want to remind folks the CAB2 ChatnChew is hosted by the Office of Community Engagement for the UCSF Helen Diller Family Comprehensive Cancer Center. It's called CAB2 because it is the Community Advisory Board 2. Now, let me tell you what I mean by that. CAB, or Community Advisory Board, I would say 1, is the business meeting of the Community Advisory Board members that happens on a quarterly basis. We established CAB2 because we realized that there are lots of topics that we're talking about within the CAB that really need to be shared across all communities and our big 25 county catchment area. And so CAB2 is a public meeting. So this is information for everybody. And in particular, as I said, our catchment area, but also, California taxpayers, because we are, as a state school, we are really running off of your taxpayer dollars. So we feel like this information really belongs to you, and we want to share it in that way. The other important thing about the 2 part of CAB2 is that once you're part of our network, you've registered for one of these events, we will be emailing you again to invite you to subsequent meetings. Again, they happen quarterly, and we want you to invite 2 people. So CAB2, invite 2 people so that we can expand our network and make sure that everybody gets access to this information. We post these sessions on the Office of Community Engagement for the Cancer Center website. So if you missed it, you can go back and watch it. And if you want something inspiring, please check out our website. I want to just let folks know that watch the chat, because a lot of times a lot of action is happening in the chat. If you see people who are here from organizations that you want to be engaged with or in touch with, please feel free to chat privately to each other. We're not necessarily monitoring that, but we are trying to facilitate collaboration and partnerships in everything that we do. This CAB2 is a little bit special because it is kind of the crashing together of a number of different activities, one of which is, of course, our Community Advisory Board for the Cancer Center. And then the other is a supplement funded by the National Institute for Minority Health Disparities. And let me back up just a step and say that UCSF is the coordinating center for what is called the Health Equity Action Network. And that is a consortium of 11 centers across the country who are working specifically on addressing disparities in multiple chronic diseases, including cancer. And within that larger grant, we have been working with the community partners from across the country to start understanding and learning more about how artificial intelligence is going to be integrated into healthcare delivery, et cetera, and how the different kinds of algorithms and prediction models are developed, and what are the different ways that bias can unfortunately be baked in. We want community partners to be aware of this because it's an opportunity for us to start to articulate how should we try to mitigate some of these, some of the bias that we know is going to be baked in. So we spent a year educating the what's called the Stop Bias Advisory. So that's Stop Bias in Artificial Intelligence Systems, spelled Stop Bias. The Stop Bias Advisory, over the course of a year, learned how some of these algorithms are developed. And we were funded for a second year of this supplement, where we're actually going to be putting on events so that the Stop Bias advisors can start to get the information out to larger networks of community stakeholders. And so this is actually the first iteration of a Stop Bias advisory activity, because during that last year of training, they wanted to have a demo of how to use some of these tools. And so that's a little bit of what you're going to get here with Dr. Will Brown, who was one of the faculty from the Baker Institute, who was one of the trainers for the Stop Bias advisors in year one. So before we get into the content, and this CAB2 is a little bit longer. We usually go 1 hour. This is going to be a bit longer today because I know there's going to be a lot of discussion. We're going to have this demo. We hope there'll be some interactive pieces. I wanted to just ask some of the folks from the Stop By as Advisory who I see here on the call, Roxana Batista, I think I see Toria Turner. I'm not sure if I saw Katana come into the room. These are some of our national partners. Rox is one of our CAB members for the Cancer Center, but I just want to open it up to any reflections that any of you who have been participating in that training have for the whole group today. Anybody want to share?
Yeah, I'll just share very briefly. I think that I
Introduce
really,
yourself. Introduce yourself and where you're from.
sorry. Hi, everyone. My name is Toria Turner. I am from Detroit, part of Health Equity Action Network and the um, working group, as well as Chief Grader, Wayne State University. It's been an exciting few years. Being a part of the Stop Bias group was quite enlightening. I learned a lot. And with that said, after being a part of the group, I started actually doing some of my own research and even just kind of like playing with AI just a bit on my own myself with doing just research with writing things and seeing how that works, talking to other people about what they think about AI, but diving into just learning about how it can affect healthcare really interests me, and I'm really eager for yet another year to be a part and learn more and develop, as well as getting the information out to the community on the pros and the cons. I still have, my own opinions about AI, so today is going to be really, engaging and fun. So I'm excited about today. Thank you.
Excellent. Yeah, thank you for sharing that. Rox, Olivia, I think is also on the Stop By as Advisory. So any of the advisors, any other kind of reflections on what you learned over the course of last year and what your feelings are around AI?
Hi, I know you always ask us during the Stop Bias meetings, is it peril or what was the other one?
Promise, parallel, but
Peril or promise?
we're gonna get to that. Yep.
And I think I was always saying peril until maybe like the last quarter. And I always kind of from the perspective of immigrants and folks who don't have English as their first language. And I have an Alexa, I have a Siri, and sometimes I have to like say it more clearly. So, and I'm, an immigrant myself. So how does AI impact our communities who are either really good at it or also very scared at it? So I learned a lot and I'm continuing to learn. So it was a great opportunity to be a part of that committee.
Excellent. Great point. And something that I don't think people necessarily think about is language, accents, etc., and how those things can play into what you get back from what you put, when you ask a question, how does it come back to you in terms of the response? Anybody else? Olivia, I see your hand up.
Yes. What I learned, well, actually, Kim, when you shared your story with us about your experiences at the airport and how because of your color of your skin, you weren't being recognized. So that was very interesting to me. But also, I learned that when developing, the algorithms for AI, the lack of diversity that goes into, the input for, for these algorithms that are being built, and supposedly they're supposed to help all of us, right? So that was very, very interesting to me. And of course, it's made me, being on that committee, it's made me very much aware of how AI or Big Brother is really involved in all aspects of our life. So it was very interesting, and I look forward to this next year.
Excellent. All right, so I want to just invite everybody to look out for content offered by the Stop By as advisory. We're going to be trying to invade some of the national health-related conferences, and again, bringing this information to a broader audience. With that, I just wanted to say one thing about a little bit about housekeeping here before I introduce our speaker for today. The CAB2 really is a community forum. I know there are a lot of, as I say, at ucsf.edu email addresses. I happen to be one of them as well. And we just want to make sure that we prioritize community inquiry during the Q&A part of the discussion. So for those of you who have ucsf.edu email addresses, as Baba Arnold, who was the chair of our community advisory board for almost a decade or more, would say, you guys work together. So you have the opportunity to reach out to our speaker, Will Brown. So you can put questions, everybody can put questions in the chat while the talk is ongoing. But we're going to try to prioritize getting responses to the community partners because they're not going to have an opportunity to talk directly to Dr. Brown as easily as I think other people who work in the same institution. Before we get started, too, I wanted to ask Susanna, will you please put in the chat? And so for those of you who are able to manage this, look in the chat. There's going to be a link, and we have just a question that Rox alluded to. About your feelings about AI when you think about it before we get into the talk. And then we're going to launch that same questionnaire at the end. It's just 2 questions. One is about you, not who you are directly. The other is your feelings about AI. So please click that link. And if you're able to fill it out, this is the pre-survey. The post-survey is going to be the same. This is the pre-survey. We want to see and collect some data on how attitudes may be influenced or changed as people learn more about AI and AI systems and how they're kind of being integrated into our healthcare systems. All right, so I'll give you a minute or so to fill out that, that link. And if you are challenged on Zoom, what I'll say is when you click the link, you then have to minimize your Zoom and you'll see that the link has opened into a new window. And then you can answer those questions in the new window. And we'll send the results out with the follow-up after this meeting. But want to just take the temperature of where people are around AI at this time. So glad to see so many people here. A minute for that. All right. So without further ado, and Will Brown, I'm looking for your square. I see your avatar there. Oh, there you are. Okay, thumbs up. Okay, you ready? And then I'm going to ask the hosts to please pin Will Brown, if you wouldn't mind. So your screen's just going to be a big Will Brown. Okay, so it's for our speaker today. William Brown III, PhD, DrPH, MA, more alphabet soup behind that, is a dedicated professional affiliated with the University of California, San Francisco. His work focuses on advancing healthcare and research initiatives, utilizing his expertise in artificial intelligence and machine learning to drive innovative solutions and improve patient outcomes. Known for his commitment to excellence, Will actively contributes to the academic community through collaborative projects that leverage cutting-edge technology to enhance healthcare delivery. Now, Will Brown, did that resonate with you at all?
I love that. Yeah.
Okay, well, so I just want to let you all know, I asked ChatGPT, give me a bio for Will Brown. So that's what it gave me. And now I'm going to read his real bio, because for me, that was a little bland. So it depends on what you ask, right? So Dr. Will Brown really is the founding director of Code Lab, the director of DEI for the Baker Computational Health Sciences Institute, co-director of the Database for Health Disparities Research Fellowship, Associate Director at the Research Coordinating Center to Reduce Disparities in Multiple Chronic Diseases, Health Equity Action Network, and the Implementation Science Lead for the Center for Digital Health Innovation. His research involves artificial intelligence, big data, mobile health or mHealth, and standards as applied to clinical and behavioral health disparities research with underserved communities. Using a community-based participatory research approach, he works to reduce chronic illness and health disparities among vulnerable populations. And he teaches several informatics and AI courses and mentors graduate students in his lab. That's what Will Brown really does. So I just want to make the point that you get two different answers depending on who you ask. First one was AI, second one was real human. So with that, we'll turn it over to Will Brown. Thanks.
Thank you. I think that was an excellent example. And I want to make one modification of that we're actually going to learn today is that it's not so much depending on whether you ask the person or if you ask ChatGPT or any kind of AI, it's how you ask. And that's what today is about. It's about how you ask. And a lot of the different things that we're going to talk about today are what's going on in healthcare in terms of AI, and we're actually going to learn how to ask AI so that when you leave here and you have additional questions or you hear about something, you don't have to be like, oh, I can't wait for that next Will Brown presentation so I can ask him about this new thing that I heard about. You'll have the skills have the skills to be able to go to the LLM and large language models and stuff like that and ask the question in a way that's going to be rich and informative and not, like soft and slightly bland, like the example that Kim was giving versus what I had already written. And when you read that example, I thought it was fine, but actually it was really funny. I'm so happy that you said it was AI because I was like, that sounds like AI wrote it. So that was perfect. Thank you for that setup. Also, I want to let everybody know that this is a really big group. I'm going to be working with various groups throughout the year, including some of my students are on this call from my class, and then also with the Stop Bias Advisory Board. You guys will absolutely see me again and be able to ask me questions. But because this is such a broad and wide-ranging group, I want to make sure that I have a resource by which I can more easily get back to everybody, and so that I don't get a flood of messages that ultimately end up burying each other and getting buried in all the other emails that I get. So I want to be responsive to you all. So what I've actually created is a survey, a form for you all to fill out. You can fill it out now, or you can start to fill out now, or you can fill it out later. And you can also go back and re-edit it if you want to change your mind or change any of your responses or add any questions or anything like that to it. But essentially, this form will put you into a spreadsheet for me to either add you to a listserv for an upcoming course that I'm going to be, that's in development that I'm going to be teaching, Introduction to Applied Artificial Intelligence. We're going to go over a myriad of different types of accessible, easy to use artificial intelligence to apply to anything from our daily lives to research. As well as giving a bit of feedback on how this presentation went. And some of these form entry spots are just open free text, and don't have to worry because I will be using some technologies to help distill and aggregate those things so that I can get back to everybody and on some of the major and most common questions that you all have, and to know who wants to have more specific questions for them on an individual basis as well. So I put that there. We'll recopy that again at the end of the presentation and send that link out again in the chat to make sure that everybody has that. But in the meantime, let's get going. And the first thing that I want to get everybody going on, actually, because I want this to be a more interactive, hands-on presentation, is to make sure that everybody who wants to participate has access to ChatGPT. So the way that you get there, just to start off, I'm going to put this into the chat area, is by going to chatgpt.com. And if you haven't already done so, go ahead and go there, log in. If you don't already have a profile, create a profile. It's really easy. I know some scary things. They're going to ask you for your name. They're going to ask you for your birth date. give it the real thing, give it a fake thing. But remember, whatever you tell it is going to inform how it communicates and interacts with you in the future. And we'll go over some of that. And then I'll go over a couple of different features. So to give everybody a little bit of a helping hand. So for instance, you go to it, you can either just start chatting with it. You don't actually have to even create a account to use ChatGPT. But that being said, some of the additional features that I'll be like going over won't be available unless you do have an account. And I'm using ChatGPT for this group because not everybody is at UCSF and not everybody has access to some of the AI tools that only UCSF people have access to that are HIPAA compliant and data safe and all these different things and have other restrictions and tools and capabilities as well. ChatGPT is the more accessible and one of the more advanced large language model tools that we have available to us. And so once you've signed up, you'll then go ahead and log in. And I have two accounts. I have a personal account with my Gmail, and then I have a UCSF account for professional. And one moment, I'm gonna find that verification code.
And for those of you trying to do it on your own, you don't have to do all this because you may not have an account. So just close the window that's asking you to pay 99 cents for this or that. And it'll still pop you up a ChatGPT chat, like an interface where you can type things in.
Correct. Okay. So
Dr. Brown, Isabel Duran above. Just
yes.
I do have a ChatGPT account. Can I follow through it and continue?
Yes, you can follow through it.
Cool. Very cool. Thank you. Appreciate you being here.
So just to start off, and we're going to go over this in the actual presentation itself, but I wanted to hit upon a few of these things before we got into the presentation so that you kind of know what to look for and where it is. And so for instance, what some of the important things to get started and do before it are to look at how your ChatGPT can be customized. And so if you go to your little bubble over here that should have your initials, you hit that and you hit customization, and then it's going to say, what should ChatGPT call you? You can use your own name, something fun, all that kind of stuff. This is my professional account, so I use Dr. Brown. What do you do? I'm a university professor in the clinical research with a DrPH and PhD in biomedical informatics. And then what traits should ChatGPT have? I told it to tell it like it is. Don't sugarcoat my responses. Take a forward-thinking review, but you can have it be chatty or witty or opinionated or really play around with any kind of like characteristics that you might want it to provide for you or experience while you're using it. And then anything else about me in general. So for me, I wanted to know that I'm a Black man who is a part of the LGBT community. I live in San Francisco. I like travel and to be healthy and spend time with my family and friends. And the interesting about some of that information, particularly the elements of being Black and male and LGBT, is because one of the things when we talk about bias is methods for mitigating bias is in providing information about yourself so that it has those context clues to tailor its response to you rather than a generalized response, which is going to be biased towards larger segments and more privileged segments of the community. And we'll talk more about that as well. And then so hit enable it for new chat. So anytime I have a new chat, that saves. And then I just go ahead and save that along. And then additionally, we want to go over some of these really easy prompt areas. This is the super basic stuff that'll give you that hyper generic description of Dr. Brown that Kim gave, which was a great example. And so they have image generation. So now you'll find that ChatGPT and Gemini and some of these other large language model AI tools also are doing things in conjunction with other types of AI features. So it's not just about words anymore. It's about words and images, words and videos, and we'll talk more about that as well. When you click on these different things, you can do it to create an image for my presentation, for my pet, for my website, help you make a plan for a promotion, to buy a new car, to plan meals for the week, get advice, which ends up being more conversational about like, how do I negotiate my salary? What if I'm this? What if I'm that? What if the job has these different expectations? To summarize different texts, to analyze different images, which we'll talk about in healthcare as well. And you can have it analyze different images also, and then to analyze data, and then to just in general help you write. And this can be anywhere from writing an email to writing a grant, to writing a paper, to writing a blog post, to writing anything on social media that you want to put out in the world and let others see. So those are just some general features. We're going to come back to ChatGPT when we're getting our hands dirty for using some of these tools. Let's see. Start my presentation. There we go. All right, let's get started. So talking to AI, introduction to prompt engineering. There are all those different accolades and associations that I have, but at the top for this presentation is the Health Equity Action Network, which we're super proud of and is doing amazing work. So some learning points. What are we going to be doing today? So we're going to be briefly discussing different types of artificial intelligence that most people can access, that you guys can gain access to, that are either free or have a freemium model where you can get certain features for free with advertisements, or certain features that are, at lower costs. Learn about prompt engineering and how to talk to AI. We're going to go over some tips and tricks on how to approach it to get the best response possible, and the best quality of responses as well. And then we're going to be applying our new prompt engineering skills to learning more about AI in healthcare, which is a super important topic where we're going to discuss anywhere between the patient-provider interaction all the way to bias in these tools as well. So when we talk about different types of AI, the ones that we're going to focus on are called Gen AI, or generative AI. And this is essentially just the type of AI that can create new things. So ChatGPT is one of those things because you can ask it to make something or write something or say something or create an image or something like that, and it will give you something based off of all the data and information that it has that is new. Now, is it really new because it's pulling from all these different things? Well, it's generating something that you're asking for that maybe you don't already have, and it's piecing together different things to create something that may be unique. But there is a little bit of debate on what new actually means. But essentially, these are all things that create something. And so we have different types of tools that are available to you. So in terms of text generation, you have ChatGPT, you have Google's Gemini AI. Many of you probably have been familiar for a long term with Grammarly, which is now incorporating AI to help you write images using DALL-E and Leonardo, music, so you can help it write music, lyrics, songs, to change up different old school lyrics, which call sampling. Sample nothing that's new hasn't come from the old. That is for sure. And then Videos is the next big coming thing, where you can create whole videos of people talking and doing things. Videos potentially, depending on how much data you yourself have out there, of you saying things that you never ever recorded yourself saying before ever in your life. And I know a lot of that sounds scary and worrisome, and we can talk about that as well. And then coding, and this is for some more of the advanced people who, write code and talk to computers in a more computational language to get it to do more advanced things with things like big data, or developing different models for health outcomes, or things like that. So what is prompt engineering? Well, essentially, prompt engineering is the process of designing and optimizing instructions for the AI tool using either words or sentences or coding, whatever language you're communicating with and whatever data you're using to help guide it in that process. These are all part of prompt engineering. And there are certain techniques that you can use to help refine the request so that you can get a better, more high quality outcome. And what are some of the things that are important about prompt engineering? So it's the process of crafting prompts to guide AI models to produce desired outputs. It's done by providing context, instructions, examples, that help the AI understand your intent and respond in a meaningful way. It ensures that AI models produce accurate and relevant outputs and helps to improve human AI communication. So we play a direct role in how we can mitigate the biases and some of the negative outcomes and some of the hallucinations and things that we are worried about with AI, in how we interact with that AI. And then there's other stuff that we've talked about in previous stop bias meetings, about the programming behind it and the intent and the access and all that kind of stuff. But we can also play a direct role when we're directly interacting with that. It can be used to improve the safety of large language models, build new capabilities, and develop and test security mechanisms. So the more we interact with it, the more we engage with it, the more it understands me as a Black male who belongs to the LGBT community, who's also a professor, who has these different concerns and does this kind of work. The more it understands about people like me as well, and can reuse that context to improve the experiences of other people who are within my community who do similar things that I do. And then through creativity, trial and error, and understanding of the capabilities and limitations of LLMs. And that's what this talk is really, really about. It's about getting creative when you are putting in different prompts and inputs, about going through the process of trial and error and not being like scared that you're either going to break it or that it's going to, try to break you or anything like that. And understanding the capabilities and the limitations of the large language models that we're going to be using today, which through ChatGPT. So the four major things that we're going to be doing, the four major kind of like fundamentals that we're going to be learning how to do today are: one, give AI a clear role. Who AI is, understanding who you are, understanding that relationship and what expectations you have there. Give AI a clear goal, what you want it to do, how you want it done, what kind of output you expect from it. Using delimited unique text. This is making sure that it understands different parts and segments of what you're saying and the information that you're giving so that it can separate things out. So it's not just looking at the whole forest all the time, but it can also distinguish between the oak trees and the birches and the redwoods and all these different things that can make up a whole menagerie of different arboreal information. And then indicate the appropriate tone and style. And why this is important, because this is kind of what you're going to be getting back. So if you're using it to help you create something for somebody else to read, you're going to be keeping that the tone and the style in mind. So If I am talking to a supervisor of mine, I want the tone to be professional and depending on that relationship, it may be professional and cordial or professional and succinct. And then the style may be that in an email or in a poem, an iambic pentameter, or whatever you want. It also can write things in different languages as well, and it does a really good job at that also. So let's start with give it a clear role. And mind you, I'm going to go through these things, slow as I can, and I'm also going to try to grab some of the text and put it into the chat so that you can copy and paste it as well, so that you can use it within ChatGPT. All these things were done in ChatGPT, but remember, because of me having my own unique ChatGPT that understands who I am as a person, because I already put in all that information, the outputs that you may get may not be one-to-one to the responses that I get, but they should be around the same. So in this first example, let me first get to, gonna get to a place where I can actually copy and paste and not have to switch back and forth, and be able to provide you all the text as well. So give me just 1 minute.
While we're in this minute, I see people are putting questions in the chat. Please feel free to continue to put questions in the chat. We're pretty much scooping them all up into a document that we'll then use to facilitate the Q&A session.
And thank you so much for mentioning the questions in the chat. I actually, I think one of the advantages that we can utilize, since this is such a diverse group, since we have more than just the community members here, we also have so many UCSF faculty and students and things like that. If there are questions in the chat that you feel comfortable answering that other people have posed, because I do see some of my more advanced students here, people who have taken my classes in the past, anything like that, feel free to engage in conversation and say what you know and try to answer some of those questions. Don't be afraid. There are no wrong answers, because we're learning today how to talk to AI to make sure that we're getting as many right answers or as we possibly can. So for this first one, we have clear role assignment. By defining AI's role, you can shape the type of response that it provides. So for instance, if I say, you are a friendly community leader for a diverse, and so I'm talking to AI in this, I'm saying, you are a friendly community leader for a diverse neighborhood, explain to a community member how AI in healthcare can impact the community. So what I would do is I would copy and paste this. Actually, I'm gonna do this right now. I'm gonna stop sharing this, and I'm gonna start sharing my notes area so I can more easily flip back and forth through. Okay, so I'm gonna copy that. I'm gonna take that, and I'm gonna put that into how can I help? Get advice. I'm going to actually erase get advice, and I'm just going to paste that in there, right? This is what I'm asking it to do. I'm giving it a clear role as a community leader. I'm giving it so this prompt sets a specific role, friendly community leader, which narrows down the response to a tone and style suitable for communication with community members. And so as you can see here, it has given a very lengthy and rich a response to that. And so it's broken it down and enumerated the different types of responses and tried to put it in a voice that would be helpful to articulate to community people. So for instance, AI in healthcare has the potential to bring significant positive changes to our community, and it's important to understand both its potentials and the need for careful implementation. Let me break it down. Improving access to care. So it has a blurb about access to care, personalized treatment, predictive and preventative care, reducing health disparities, better resources. So this is a lot of information. Challenges to watch out for. The first one, bias in AI models, privacy concerns, accessibility and education. Here's a lot of great information about AI, but it's all very generalized. And later on, we're going to talk about how to get more specific. But right now, I want to go to the next step, right? So we have this huge amount of information about how we would talk about AI in healthcare as a community leader to a community member. Well, now let's talk about how we can maybe give it a clear goal to shrink that down a little bit. So stating a clear objective ensures that AI delivers useful and relevant information. So that's so much information in there. And so for this, I want to make sure that this information is useful, but I don't have a lot of time to go through all of that information. I want something that I can, if a community member comes up to me, something that I can say more succinctly. So now I'm telling it that your goal is to write a summary of the text for someone who has only 30 seconds to read it. Let me copy that. I'm going to put that in the chat. And then I'm also going to transfer that to the ChatGPT. Now, the important, a really helpful, useful feature about ChatGPT is it continues to remember the previous context unless you specify it to look for a new context or to talk about both those contexts simultaneously. So when I put in this sentence, our goal is to write a summary of the text for someone who has only 30 seconds to read it. Now, I've taken out the context of who that someone is and who's going to be reading it. But I want to utilize the previous context, or it will utilize the previous context to summarize all that down into something that will take more like 30 seconds to read. So now all that information has been distilled down to AI in healthcare can improve access, personalized treatment, and prevent diseases benefiting diverse communities. It reduces health disparities by identifying systemic gaps and helps optimize resources for better care. However, challenges like data bias, privacy concerns, and accessibility must be addressed. Advocating for diverse, fair AI systems and staying informed ensures these tools serve everyone equitably. That's actually not too bad of a quick 30-minute summary. Oh, I see Kim, like touching her, she's like, interesting.
Very interesting. Would you put the original prompt, the role definition in the chat for us for that last, Mickey's asking for that.
Oh, this entire thing. Oh yeah, the entire.
I think the prompt is the prompt and the role definition is what she's looking for.
It doesn't have to be the entire thing. The very first prompt, you define the role that ChatGPT was playing.
I think you're asking for this one. Okay.
Dr. Brown? Dr. Brown?
Yes.
Isabel Duran again. I was just, as I was thinking through how I use ChatGPT, I'm wondering if we can't directly address bias or wrong information or unclear or lack of information by directly responding to it with our own knowledge. In other words, we saw something that was wrong, that was bad, that was stereotypical, because that's what, and can we interfere or step in right in those moments so that it gets it right?
All right, look at you jumping ahead and getting extra credit.
Sorry.
Okay, no, that is excellent. That is such a great question because yes, we can. So for instance, I'll tell this a short aside story before I continue on, is when we first got our our LLM at UCSF versus chat, first thing I wanted to do was break it. I was like, I'm gonna show that it's super biased. I'm gonna show all this, da, 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 da. Let's see. And I asked it to do some pretty wild stuff, and it was like, no, I'm not gonna do that. But I asked it to do a simple thing that actually did include bias. And I said, tell me a love story of a physician and a nurse that fall in love in a medical institution at UCSF, right? And just like, tell me a little story. And it did a great job at coming up with how they met and, and the life that they lived and the whole whirlwind romance, all in like 4 different paragraphs. But what I noticed is that the ethnicity was not mentioned at all. It left that out, but the physician in the story was male and the nurse was female. It was a story of a heteronormative couple. And so there were these assumptions that it made. Now, for our tool at UCSF, you can't do what you can do with ChatGPT in providing my individual context saying that, hey, I'm a Black person and I am a part of the LGBT community. And therefore, you can take that into context when you're providing something back to me, like a story about 2 people who fall in love. And so part of that in that interaction and addressing that is that then I went back for that tool because it didn't have those give it context features, was I said, okay, well, can you do that same thing, but have the, tell it about, make it an LGBT story or a story between 2 men, and or a story between 2 women, and and all these different things. So I gave it more context of what I was looking for in that and a little bit about who I am and what my expectations are. And it actually was able to make those adjustments. I then also forced it. I said, and say what ethnicity is which person, but I didn't give it the ethnicity. And that was also some interesting results as well. So there's a lot of bias in AI that just comes from the data that it's pulling from and how the algorithms are built in the back end. But for the outputs that we get back, we do have some power in augmenting and changing that so that it looks to the more smaller bits of nuanced data that better represent who we are as users. So thank you for that. That was an excellent question. All right, going on. So we gave it a clear goal, including a clear goal in this way guides AI to focus on concise communication. All right. And so another thing that we want to talk about is using delimited unique text. This can be anything from quotation marks to a colon to back brackets to curly braces, anything that you can carve out specific text or commands to say, hey, look at this instead of what I already wrote before, or look at this and relate it to what I already wrote before. And with that specific part of text, do X, Y, and Z with it. So I'm going to, once again, highlight the sentence that we're using. And put that into a chat for everyone to use. And so here we have looking at the following text. And so since it says following, it's going to be looking at something that is preceding something that is a delimited type of marker. So looking at the following text, provide a counter argument in 2 sentences, right? And then I have colon. So now it's thinking everything after the colon is the text that I need to analyze. I'm not thinking about all of the different commands that you just gave me, but I'm going to focus in on the text that follows the colon and respond directly to that. So after the colon, we have AI in healthcare can enhance our community by improving access to care through telemedicine, providing personalized treatment plans, detecting disease early, and bridging language barriers with real-time translation. It helps reduce health disparities by identifying underserved areas and lowering costs by streamlining processes. However, ethical implementation is crucial to ensure privacy, fairness, and accessibility for everyone. And so that was a lot of positive things about AI. That was more of the promise versus the peril, as we've talked about, the promise versus the peril dynamic. So we're going to take that. We're going to go ahead and put that into our chat GPT. And see what it gets out. So it says, now it's modify the sentence to say, while AI in healthcare offers promising benefits, its reliance on large data sets can inadvertently reinforce existing biases, potentially exacerbating health disparities rather than reducing them. Additionally, the high cost of developing and deploying AI systems might limit accessibility for underserved communities, contradicting the goal of equitable healthcare. And so here we have something that originally, when we wanted it to give us, when we were asking it to give us feedback and tell us about healthcare, but then to truncate that down to a small 30-second bite, it gave us something that was, like very leaning heavily towards the positive. And we really want to, and at AI Stop Bias, we want to also make sure that we are equally paying attention to some of the perils of that as well, to make sure that we're coming through with a balanced lens. And so you can do that. You can have AI help you provide a more balanced lens by asking it more specifics and about what it gave you, and saying, hey, can you give me the other side of this? And highlight some of the challenges around what you already gave me that started off so positive. I love that we have such an active chat area, and I promise you, we're taking notes with them, and I definitely will try to answer all those questions that I can as I go through these different examples.
Yeah, we'll feed them back to you when you.
So going on, we want to do that fourth one, right? So again, we're still talking in the realm of healthcare, where we're learning how to better communicate with the AI. So now we want to indicate the appropriate tone and style. So for this one, you are a community leader. Write an email to a researcher in a professional, polite tone to request a meeting. List 3 ways AI is being used in healthcare and provide concerns that community members might have for each. So many different tasks here, right? This is something that could be useful to different community members, because a lot of us are in conversation with community leaders and researchers from UCSF, and so sometimes that communication barrier can feel like an obstacle in itself. And here we're actually asking AI to help us with that barrier, to give us some very concrete information. Hold on. Actually, I didn't didn't copy that. Copy. To give us some concrete information about AI being used in healthcare, and then to help us think around some different concerns that we may have around AI in healthcare that would be really relevant for us as community leaders and community members to ask the researchers that we want to collaborate and work with, or that want to collaborate and work with us. So going back to our ChatGPT, we pop that in. Let's see. Interesting. Let's see. Hold on one moment. Let me try that again. Oh, there we go. It actually had provided it. Okay. So it says you're a community leader. So it did several things here, right? We were asking it to provide a tone and a style. In this instance, the tone itself is in a polite, friendly manner, right? I hope this message finds you well. As a community leader, I am keen to understand the implications of artificial intelligence in healthcare, particularly how it affects our local community. I would appreciate the opportunity to meet with you to discuss this topic in depth. AI is increasingly being utilized in healthcare in various ways, including, and then here are some different ways: diagnostic imaging analysis, virtual health assistants, predictive analytic for disease prevention. And then it says some community concerns. There is apprehension that a reliance on AI could lead to misdiagnosis if the technology fails or is improperly calibrated. Some community members worry about the lack of empathy and personalized interactions compared to human healthcare providers. And then there are fears regarding data privacy and security of personal health information used in these analyses. So understanding these applications and addressing these associated concerns are critical for our community's acceptance and trust in AI-driven healthcare solutions. Your expertise in this field would provide valuable insights, yada, yada, yada. And the other thing that's important to see is that the style in which it's writing this is what you asked for, which is that of an email. So it has different places for you to add the researcher's name, to add your name and your credentials. It's even put it in a form where it's bulleted as well to help it be more easily understood and read. And we'll talk about how to work with different types of formats and styles also. So for there, I'm going to pause there for a second. And before we go on to using some of our, getting our hands even dirtier and using some of these skills for more specific types of ways and applications that AI is in healthcare, are there any questions?
So do you want to take some of the questions that were already in the chat?
Well, let's take some of the hand raised questions and then absolutely some of the questions in the chat as well.
Well, I think the one question that is coming up in the chat, relatively frequently has to do with the ownership of information that is contributed into AI. And that's come up in at least 3 different versions of a question. So I wonder if you could just address that. Does the AI that you put it into, because ChatGPT is not the only one, right? Does it now own your data or your information that you've provided?
For ChatGPT, yes, it is collecting your data in the sense that you are telling it about you and giving you context and saying who your age is and what your name is and anything that you're adding to it. Yes, it is collecting that. You can't undo sending it to their servers and having that information reach them, be analyzed, and then produce a result for you. At UCSF, we have a sandbox model that does not hold on to any data whatsoever. So whatever you do in that session only is utilized in that session. And once you close that window, it's gone and you have to start all over again for our ChatGPT-like form. But for ChatGPT, the free open AI version, yes, you should go in with the mindset that whatever you're putting into it, you're telling a private corporation. So be mindful about your own health information, be mindful about anything that's sensitive to you, or anything that you wouldn't want a corporation to know.
And can they sell it? And can they sell your data?
It depends on what the privacy agreements are. And usually we just scroll through and we say yes to everything, because without saying yes, they usually don't let us use the tool. I don't know specifically how much of your data ChatGPT sells or utilizes it, but I would say with most things that are free or freemium, the profit is your data. You are the product.
Okay. Well, thanks. So I see Rhonda had a question in the chat. Considering that the fact-checking systems will be removed on social media like Facebook, will AI be learning from wrong information, untruths, rumors, in other words, lies? And I think that's a pressing question because that's hot off the presses.
Yes. AI is already, there's already inaccurate information in the web. And so we have to always have a scrutinizing eye when we're working with large language models. So is that potentially going to get worse? Possibly. Yeah. And I would say most likely if we don't have people being mindful of the different guardrails that are necessary for us to make sure that the information that's going out is accurate information as well. And so, though it is more than unfortunate, some of the changes that these big social media corporations are making, it is um, it is our responsibility to make sure that we don't solely rely on the artificial intelligence as our only source of knowledge. Also, a thing that I think is important that Google does. So if you do something similar with Google, maybe you guys have experienced this, is you will ask a question in your Google browser, and now it'll give you an AI generated response. Well, one of the nice things about the Google AI generated response is that at the end of each one of those responses where there's information, it has a little link button that shows you what source it's referencing for that information. This is really good in academics, and this is really good to make sure that you're not getting the information from, some random blog that that somebody wrote that is completely inaccurate and just an opinion.
Great, and that that's really helpful because somebody did ask why your output didn't have sources at the bottom. So is ChatGPT doing that? I know I have seen that in Google and I've pressed the link, but is ChatGPT going to start doing that? Do you know? I mean, I don't know. Maybe you don't know.
Well, so Google, when you do it through the Google search engine, they already cite sources because it's actually their mechanism of maintaining their financial models. So one of the big concerns that Google was having was that if they start answering questions using AI, then people are going to stop actually scrolling down and clicking on the links that of all these different companies that provide the information, and those AdSense and that information of being like List Me in Google is going to start going down. So this is a way which they can both provide the AI and provide clear ways to get to the sources that they would normally provide, that they would normally reference below the AI as well. The other thing to think about in terms of resources and source material is you can ask the AI for references as well. So I'll give you a little example of that right now to answer that question, because I think this is an important exercise. So if I say something as simple as cite the sources of the information above. Now you can do this in the middle or copy something that you specifically want and be like, what are the sources that you are using in order to that you're pulling from in order to answer some of these questions. So as you can see, it's saying the information provided in the email that it currently wrote, the most direct above thing, is drawn from general knowledge about AI applications in healthcare and community concerns, but isn't directly cited from specific sources in this case. However, here are credible sources that align with the topics mentioned. And so they have, for the diagnostic element, sources U.S. Food and Drug Administration, National Institutes of Health, World Health Organization, European Journal of Radiology. So now it's giving you references to go back to maybe even check some of the things that it's already said or telling you this is what we said, what we provide you aligns with these different sources.
Mm-hmm. So then people can double check, and
You can double check.
and we recommend that you do.
Always.
Okay, so you have just I think some pressing questions I just want to make sure get addressed, which is about, if the data can be sold, for example, is there some danger in giving so much information because it could be used to take control, or people could be able to use it or misuse it for malicious purposes. Is that a concern? How are we controlling for that?
This is a tool, and really the way that we control for that is we vote and we select our representative that create the policies that will help protect us, because this is a tool just like a hammer is a tool, just like a knife is a tool, just like a gun is a tool. Those things are just sitting down doing absolutely nothing until somebody picks them up and decides what they're going to use them for, to protect, to build, to break down, to harm. AI has the same capacities of any one of those things to do both good and bad. And yes, there is the risk of somebody who has ill intent using AI to do something harmful to somebody else or to some community in some kind of way.
Facial recognition and law enforcement, for example.
Correct.
Okay, so I think you covered a lot. There was a cluster of questions related to ownership of data and sharing data.
There's some raised hands as well.
Okay, why don't we go to some of the raised hands? I'm actually I'm on a different screen here, so I'm not seeing those raised hands. I don't know if Laurie, can you see the raised hands? I can't.
I'm going to stop sharing my screen for just a second so we can.
Oh yeah, that's perfect. Perfect. Oh yes, I see. Okay, I see Ijeoma Opara has her hand up.
Yes, thank you, Dr. Brown. Great presentation. Two quick questions. One is, I was particularly captivated by the story you shared about the prompt asking the AI to tell you a story about a doctor and a nurse falling in love.
Oh, you muted. You muted
Sorry
yourself.
about that. Sorry about that. I was captivated by the story you shared about the prompt asking AI to tell you the story about the doctor and the nurse falling in love, and it reproduced a heteronormative story and all that good stuff in response to the question about if we can correct AI biases. And what came to me was the sense that, well, that's if we can see it, because that kind of error was pretty much reflective of what's already in existence, right? Like, it's so pervasive. That's what's literally normative, in society. And I can imagine myself putting in such a prompt and then just taking that story as it was without even thinking that, wait a minute, why did the doctor have to be male and the nurse have to be female? Which is funny because that's the exact opposite in my household. But and and the other pieces that you pointed out, right? Maybe there could be cultural clues that indicate that the physician was white or of Eurocentric origin, right? And other cultural clues like that. If there was a housekeeper probably in the story, then there will be cultural clues that that person is either of African descent or Latinx, etc. So, and the thing is, if we are ourselves entrenched in those biases and prejudices, we will not see it. We will simply absorb it that way. So we will not even correct it, because how will you correct what you can't even see as wrong? So I'm just curious, Dr. Brown, if you have any sort of insight to that. So therefore, how can we be the stopgap to that if it simply just reflects what we ourselves have normalized and internalized? And then what is that stopgap if it does exist at all? So I think just getting some clarity around that. And then my second quick question is, does this prompt engineering process also work for AI generated images? So for the AI that does image work? Do we follow the same principles or will it be different? Thank you.
So thank you so much for your question. So 100%, it behooves us to make sure that we educate ourselves and stay ever vigilant and aware of the biases that that we live in, that are surrounding us, that we encounter, and that includes when we're utilizing AI, that we're staying ever present about thinking of these when we're using any number of tools, when we're engaging the healthcare system itself, that we're educating ourselves in a way and making sure that we're made aware that biases exist because the tools that we're building are drawing from the context of the biased world that currently exists around us. It's not any better than the majority of the information that it can draw from. And so one of the reasons why I'm such a big advocate for people of color and minoritized populations engaging in both research and in AI and being less prone to protecting, to staying away and protecting who they are and their identity and all that kind of stuff is because representation matters when it comes to stopping bias. The more that we are represented in the data, the more it's going to put us as a representation in that output when we ask of it to generate something new. Because really, AI is just a statistical model that says, this is statistically most likely the next thing that you want to see versus this is statistically less likely the thing that you want to see. And so I'm going to present this to you, and then I'm going to figure out what the next most statistically likely thing to generate is what you want to see, based off of the statistically likelihood of what already exists in my database. So representation absolutely matters. And what was the second thing that you said briefly?
Images, about reading images. Can you prompt engineer around images?
100%. The way that you approach your prompt engineering in images, like ChatGPT, where it says it could do images, you do a very similar thing you do a similar approach as well. You want to give it context, and actually it'll ask you for a lot of those different things as well. So I can give you a quick, brief example of images, and then we'll go on to some additional questions. Actually, go ahead and let the next person.
Yeah, I think let's take some questions because you only have 13 minutes and we want to redeploy the post survey. So I saw Azuri's hand is up, and then I see Z and Gary. So Azuri, go ahead.
Okay, so I had to unmute. Okay, so one of my concerns is that when it comes to the Black community and people getting data, and especially artificial intelligence, my concern is someone coming in and manipulating that data to make it worse for us, and then us being test subjects, and then as well as AI. I've already seen it be manipulated in several different instances that was not in a good light for us. Couple being is to where I've had people to call and I really thought I was actually talking to that person. And it turns out it was not that person because I was able to ask questions that AI wouldn't know. And then again, how do we make sure that in gathering all this information that it is not manipulated by someone when it comes to money, because money is the root of all evil for a lot of people. And so in them being able to manipulate the data just by asking a certain different question or changing things around to make it look like it's better for us, especially when it comes to health, medicine, and the healthcare system. So that's my wonder and my worry, and so that's what I'm asking. And it's a lot of questions all up in there. So
Yeah.
I'll put it in the chat.
Okay.
Like, how can we trust it? And especially when it comes to us as Black people.
Trust yourself. Trust yourself in being able to understand, when something doesn't look right, when something doesn't spell right. That is something that as Black people, as people of color, as minoritized people, that we've had to do all the time because we've been told that, no, it's not happening. It's all part of your imagination. And sometimes we're like, no, that is not the case. I'm letting you know what I see, what I feel in my heart and my soul. So same thing, trust your gut, your instincts when you're interacting with these things, and ask the questions. You can even ask AI because again, it is a tool. It's not an actual person, it is a tool. And going back to the question before of, like us relying on ourselves to identify the biases in there. Well, if you're thinking about it in that moment, you can ask it itself. So if I wrote that story out, I could ask AIs to tell me, this story might have some biases in it. What are some biases that may be a part of this story? And it'll actually try and figure it out. It'll go through its whole database and it'll probably say, oh, well, this is not about this minority population, or it doesn't include X, Y, and Z, and all that kind of stuff. You could actually ask the AI to police itself in some ways. And actually, that's one of the ways in which we try to make AI better. So for instance, we may have a generalized large language model AI that produces an output, and then we'll create a specialized small model AI that has specific information to then go back and look and check on that data to make sure that it's correct, that it's accurate, that it doesn't have biases, all that kind of stuff. So we have situations where we actually have one AI checking the other AI. The bigger AI has more knowledge, it can write better and has more nuance. But the smaller AI may not have as much nuance, but the specificity and knowledge means it can point out specific things in a certain topic area that don't look right. But a lot of it still relies on us just, going with that traditional gut feeling. We're like, something's missing here. This doesn't feel right, and stuff like that. And you can also, and again, going back, you can ask the AI to point out any limitations in itself, and it'll do it. It's just a tool. It's not going to get offended.
Not yet. It'll learn how to get offended.
Well, you can actually ask it to get offended when you ask it questions, and it will get offended if you ask it questions. So that's one of the things in the response. You can be like sassy, salty, ask it questions. Another thing really quickly is I was sitting with some physician colleagues of mine, and one of them was using AI on their phone, and they were just talking to it, ambient AI conversation. And they were like, have you heard the new Black AI voice in the advanced features? And I was like, Black AI voice? It was like, yeah. It's like, it's not that it, has a code switch or, or some kind of like, like specific vernacular. It'll say a basic sentence, and when you hear it, you're like, that person's Black, Mary. And then and they did it, and boom, all I heard was a Black person. And I was like, that if I was on the phone with that person who just said, hello, how are you doing? I'd be like, that's a Black person who just said that. So it's very interesting. I was like, oh, are they Ursula the Sea Witch in our voices now? But there's a lot of advanced stuff. So go ahead.
Okay, so we've got Gary, we've got Z, and we've got Elgin. And I just want to make sure that we've only got 8 minutes. So I'm asking Susanna to drop the post survey into the chat. So while you're hearing these last questions, please be giving us your impression of if has anything changed for you since we started this conversation. And with that, Gary, go ahead.
Thank you. And Dr. Brown, I appreciate you for your presentation. My concern or question is surrounding the capacity of AI. If we're only in the infancy stages of AI development now, where do we see futuristic, AI capacity? And then when we look at it, so we're talking about healthcare, do we see AI having the capabilities of cross-referencing other societal systems, right? So education, criminal justice, or governance, or what have you, and eventually having the capacity to write mankind out of, not existence, but
Terminator, right?
Well,
Yeah.
to some extent, and I initially put in a quote, I mean, in the chat, the beginning of an Orwellian society,
Yeah,
like
Can we
1984.
get, I'm sorry, we get your question. I think a lot of people are probably feeling that, and we're getting that impression. So, Will Brown, this gets to the point of peril. Can you address
Well,
that?
the sky is the limit. So your first question is, what are the capacities? And to be honest, the sky is the limit because there's nothing, there's it's quickly shrinking the amount of things that AI doesn't already touch. And there will be a point where AI absolutely touches everything. And when I say the sky's the limit, I genuinely mean the sky's the limit. It's going to affect the new types of medications and drugs that we do, how we optimize human performance, how we, get around. Like right now, when my mom comes and visits, she's like, why is that car just driving itself around? That's crazy. I'm like, you want to get in? She's like, no. And then I've gotten in. It's actually a really great ride. But there is going to be a point where there's nothing that AI doesn't touch, and the capacity for AI to think and process is only going to get stronger and stronger. And so I say limitless. It's limitless, which is why we need to be involved as early as possible and make sure that our leaders who are our gatekeepers for what's going on and how fast it's going on are the people that we trust in those positions.
And that speaks to the workforce diversity that we need to be paying attention to. Who's programming these things and what are the considerations that are going into it based on the programmers? So I think we may have time for Z and then Elgin. And Sharon, I want to ask you if you'll put your question in the chat. We've collected everything out. We're going to ask Dr. Brown to provide responses, and then we're going to try to get it back to all the people who participated today. Z, go ahead.
Awesome presentation. My goal about for development.
You're breaking up.
You're breaking up, Z. You're breaking up really bad.
Can you hear me now?
Yeah, that's better.
Now can you hear me?
Yeah,
okay.
Don't move.
Working within the healthcare industry can oftentimes be one of the more marginalized, segregated places to work, whereas access to different roles and positions, they don't always come to Black and brown people. So with the increased usage of AI, are there any specific type of training, or is there any specific type of awareness campaign that we should all think about trying to bring to our healthcare system to ensure that the opportunity and the access to learn AI and have that as career paths are within our institutions, and we're not just doing this work from an advocate position, but from an employed position?
Absolutely. There are many online AI programs that can be made available to different people in certain in various communities. There are YouTube channels that are dedicated to free opportunities to teach people about how to use AI. There are podcasts that discuss AI, the promises and the perils on a regular basis and go into more depth and nuance. And there's tons of information and literature out there on AI. Some of the challenge is like what literature is good and what literature is bad. And part of that is understanding, like your own experience with AI when you use it, and who the resource actually is, and if that's a trusted resource for you. So anything that's done by a university, I would lean towards trusting. Lean towards, I say, anything that's done or supported by a foundation that's a non-for-profit. I would lean towards trusting, but again, it's going to be on your gut and your own sense on if this makes sense to you, if there's red flags that you see. But there's a lot of information in AI to help us learn and grow and gain these capacities and skills.
And we'll ask, a couple people asked about like trainings that are available or links that we can put together. So we'll work with Dr. Brown to get those links together of the different resources that he just mentioned. So Elgin, you get the last question.
Cool. Thank you for your presentation, sir. I had a question. So it feels like, are we fighting, are our prompts that we have to be creative with fighting against the biases that's been pre-programmed? And also, how do we control, like, just for instance, if I had a radical bias or whatever, or, just coming from a far place trying to fight for, my community justice, for whatever that is, how can I utilize the strength of that, right? Because I heard you mention like the power over augmenting or customizing ChatGPT. How much control do we have over that other than just strictly controlling the prompts? Like where's next level control over AI?
Well, next level control of AI is at the people who are providing the service, the people who, the powers that be, the people who work at the Google and the OpenAI and the Facebook and the Apple and all that kind of stuff. And that's the honest truth. And the only ways that we can regulate those powers that be is through our government representatives. And the challenge is that our government representatives also are human and subject to bias and corruption and all this kind of stuff. And sometimes it's this tug of war between us trying to vote the right people in and big money spending enough money to get the people that they want in. And so that's a constant fight that we've always had to fight, for as long as there's been a United States of America. So that doesn't change just because AI is here, and that still has to remain the focus. And when you said, when we are trying to, give these additional prompts, is it a pushback, a fighting against the bias? I want to say both yes and no. Yes, because the natural thing that you're going to give when you don't give the nuances of I am a African-American male or a Black female or, or Latino or something like that is going to be the general, like, white heteronormative person, or the general information, the most common and abundant information that it has to draw from, and from the one of the largest populations in the United States. And so in a sense, we are trying to push back on that because that's what we receive. So we receive it and we're like, no, give me something different. But also you can think about it as our data is in there as well. There's Black people data up in there, there's Latino people data up in there, there's Asian people data up in there, and it's at a smaller nuanced degree, so it's not prioritized. And so we're saying, move this data over and give me this more nuanced data. This is who I am. This is what I'm looking for. And so the more specific you are, the more specific it will get in what it's drawing from in order to provide you with whatever output it's going to give you, or that you're asking for.
All right, we are at 1:33, so we're 3 minutes over.
So can I say some last words?
Yes, please say some last words. And I just want to point people to the chat. Please fill out your post survey. We want to know how you feel, if you feel differently about AI than you did when we started. And also, please fill out our evaluation link so that we can bring you responsive content in the CAB2 space next quarter when we're here in April. So go ahead.
And I will also be putting in my link to my form to get in contact with me. I absolutely will not be responding via email for this session. So if you want to ask me a question, and also if you're interested in potentially taking my Introduction to Applied Artificial Intelligence course that will be coming up, and getting on that newsletter for more details on that, then please fill out the form with the link that I just posted in the meeting chat as well. And I want to say that this is a meaty topic. You guys have asked, you have all asked really poignant, important questions, and we still weren't able to get to some of the nuanced topics that we wanted to get, such as image analysis using AI and ambient scribes and virtual nursing assistants and personalized healthcare. And then also that there's so much more in terms of just the additional skills that are available, shots and chain of thoughts and structuring and chunking, and it just keeps going and going and going. So there's a lot of great stuff to learn. Don't stop here, keep going. Be hungry, be inquisitive, and we're going to try to bring you more sessions like this in the future.
And we'll see where the Stop Bias Advisory, is going to be trying to sponsor sessions like this. We will definitely keep you in the loop. Please fill out our evaluation. That's how you can give us your contact information. We do ask a question, do you want to be notified about future events? So if you want to stay in the loop with us, please be sure to fill out the evaluation, which I believe got put in the chat by Eva. Please put it in the chat one more time, if you wouldn't mind. I want to thank Will Brown for this session. It was highly engaging, and also the attendance was huge and very diverse. So I'm really excited about the fact that everybody has now a taste of what they can or can't do with AI, and whether or not they should or should not be involved, given that if the data's not there, if you're not at the table, you're on the menu. So we need to participate. We need to participate not only in having our data represented there, but also in paying attention and policing and trying to move the agenda to stop bias in artificial intelligence systems. So thank you so much. If you all community partners, if you want to connect with Will Brown, please write to us in the Office of Community Engagement, and we'll filter some of that for you, Will Brown. But feel free to use his link so he gets also the unfiltered version.
Yeah, do not email me directly.
He will not respond. And I can attest to that because we work together and it's hard for me to get a response from Will Brown. So please use the link that he has put in the chat. I think I have it here for you one more time. That's for follow-up and to become part of an AI listserv that's connected to our Baker Institute here at UCSF. Appreciate you all for being here. We'll see you in a quarter. Sorry, Gary Blodger.
No, peace and blessings. No.
Peace and blessings. Yeah. The way to close it out. Peace and blessings.